The gunshot wound had nicked the subclavian artery, a millimeter from catastrophic. Mara Stevens' hands didn't shake as she applied pressure, her voice steady through the chaos. "I need vascular clamps now. We're losing him." But that moment was still 6 hours away. Tuesday, 0600 hours. The ICU at Riverside Medical Center hummed with its pre-dawn ritual. Ventilators breathing for patients who couldn't, monitors tracking hearts that struggled to beat. Mara moved through the dimness like smoke, her presence so unremarkable that the incoming day shift barely registered her. "Anything overnight?" Dr. Patel asked, not looking up from his phone. Mr. Chun in bed 3 had some ectopy around 0400. Resolved on its own. "Mrs. Alvarez's pressures are holding steady." Mara's voice was soft, almost monotone. "Harrison in 5 is ready to extubate." Patel nodded absently. He'd been her attending for 8 months and probably couldn't pick her out of a lineup. Mara preferred it that way. At 32, she perfected the art of erasure. Faded gray scrubs that hung loose on her frame. Dark blonde hair pulled back in a careless knot. No makeup on her pale, angular face. She existed in the margins of the hospital, competent but forgettable, exactly as she'd designed. "Stevens, can you grab the Harrison extubation?" Charge nurse Rita barely glanced her way. Simmons called out sick. "Copy," Mara caught herself. "Sure." The military vernacular still slipped through sometimes, muscle memory from a decade she'd spent trying to forget. 10 years as a Navy Special Warfare combat medic. Pre-deployments. 42 missions that didn't officially exist. A call sign she'd earned in a firefight outside Mosul, Reaper. Because she'd brought more souls back from the edge than anyone thought possible. She'd left that life 4 years ago, traded her combat medic bag for a nursing degree, her desert fatigues for scrubs that hid the scars and the nightmares. Now she saved lives with protocols instead of under enemy fire, and most nights, she actually slept. Most nights. Mara was drawing up morning meds when the elevator chimed, and everything changed. 2 men stepped down, dark suits, earpieces, the kind of posture that screamed federal agent. Behind them came a man in a Navy dress uniform, Admiral's stars gleaming even in the fluorescent half-light. Mara's hand froze on the medication cart. Admiral Hardwick, her former commanding officer. "Can I help you?" Rita stepped forward, her voice sharp with territorial concern. "This is a secure ICU. We're looking for Commander Mara Stevens." Hardwick's voice cut through the space with parade ground authority. "We were told she works here." The ICU went silent. Every head turned. Toward Rita first, then slowly, with dawning confusion, toward the quiet nurse by the medication cart. Mara's jaw tightened. "I'm not a commander anymore, sir." Hardwick's weathered face softened slightly. "Reaper. Been a long time." "Dr. Patel," Rita stammered. "Did you know?" "Know what?" Patel finally looked up from his phone, irritation giving way to bewilderment. "Stevens, what's going on?" Before Mara could answer, one of the suited men stepped forward. "Ma'am, we need to speak with you. It's a matter of national security." "I'm out," Mara said flatly. "For years out." "Whatever this is, it's the vice president," Hardwick interrupted. "David Morrison. He was critically injured in an assassination attempt 2 hours ago. He's being airlifted here. This is the closest level 1 trauma center to the safe house where it happened." Mara's mind automatically shifted into tactical assessment mode. Injuries. Gunshot wound to the chest, possible spinal involvement. The Secret Service medic on scene did what he could, but Hardwick's expression was grim. "We need the best, Reaper, and you're the best I've ever seen." "I'm an ICU nurse," Mara said quietly. "Not a combat medic. You're a Navy Cross recipient who performed a thoracotomy with a dive knife in a crashed helicopter under active fire." Hardwick's voice carried the weight of memory. "You saved Senator Pacheco's life in that helo. Now we need you to save another life. A bigger one." Rita was staring at Mara like she'd never seen her before. You what?" "The Navy Cross." Patel's face had gone slack with shock. That's the second highest military decoration for valor." Mara ignored them both. "When does he arrive?" 12 minutes. Flight medic radioed ahead. "They're barely keeping him stable." Hardwick pulled out a tablet, showing vital signs being transmitted in real time. BP dropping, possible tension pneumothorax. "Stevens, I know you walked away. I know why. But right now, I'll need full trauma bay access, vascular surgeon on standby, and everyone out of my way. Mara's voice had changed, authority sliding through the careful softness like a blade from a sheath. Sir. She was already moving toward the trauma bay, her mind cataloging supplies, planning approaches, the quiet nurse disappearing like she'd never existed at all. Behind her, she heard Rita whisper, "Who the hell is she?" Hardwick's answer followed her down the corridor, someone who saved more high-value targets than the entire Secret Service combined. Mara pushed into Trauma 1 and began setting up. Her hands moved with practiced precision, chest tube kit, vascular clamps, blood warmer. For years of hiding, of trying to be ordinary, evaporating like morning mist. Because Reaper was still there. She'd always been there. The helicopter touched down with 7 minutes to spare. Mara stood at the ambulance bay entrance, the pre-dawn wind whipping loose strands of hair across her face. Behind her, Dr. Patel and a hastily assembled trauma team waited with a gurney. Secret Service agents had secured the perimeter, their weapons visible now. All pretense of normalcy abandoned. Stevens. Patel's voice was tight. I don't know what's happening here, but I'm still the attending physician, then attend. Mara's eyes never left the descending helicopter. Watch, learn, assist if I need you. But don't get in my way. His face flushed. You can't just, Doctor. Admiral Hardwick stepped between them. Right now, Commander Stevens has operational authority. If you have a problem with that, take it up with the President. He signed the order personally 20 minutes ago. The helicopter's rotors began to slow. The side door opened, and 2 Secret Service agents jumped out, followed by a flight medic covered in blood. They pulled the gurney out, and Mara's trained eye caught everything in 3 seconds. Vice President Morrison, unconscious. Chest wound, right side, blood seeping through pressure dressings. Respiratory rate elevated and shallow. Skin pale, diaphoretic. The flight medic had placed a chest seal, but Morrison's trachea was deviating. The pneumothorax was getting worse. Talk to me, Mara ordered, moving alongside the gurney as they rushed toward the trauma bay. The flight medic's words came rapid fire. Single GSW, right chest, approximately 3 inches below the clavicle. Entry wound only, bullets still inside. Placed chest seal at scene, started 2 large-bore IVs. He's had 2 liters of saline. BP was 90/65 minutes ago, now it's 85/58. Respiratory rates climbing, oxygen sat dropping despite high flow. Tension pneumo, Mara confirmed. How long since the shooting? 97 minutes. They crashed through the trauma bay doors. Mara's team moved like a choreographed unit, because she was directing them with the precision of someone who'd done this in conditions far worse than a well-lit hospital. Transfer on my count, she called. 1, 2, 3. They shifted Morrison onto the trauma bay table. Mara was already pulling on gloves, her hands moving with the speed that came from saving lives when seconds meant everything. Cut the shirt. Someone get me a portable x-ray now. Patel, listen to his chest. Tell me what you hear. Patel placed his stethoscope, his face going pale. Diminished breath sounds on the right. Hyperresonance to percussion. Tension pneumothorax confirmed. Mara grabbed a scalpel, her voice calm despite the organized chaos around her. I'm doing a needle decompression first, then a tube thoracostomy. Shouldn't we wait for imaging? One of the residents asked. He'll be dead in 3 minutes if we wait. Mara located the second intercostal space, midclavicular line, and inserted a large-bore needle. The hiss of escaping air was immediate and dramatic. Morrison's oxygen saturation began to climb. Better. The flight medic nodded. Jesus, you're fast. Lots of practice. Mara was already prepping for the chest tube. Someone page vascular surgery. We need to find that bullet and assess damage. Patel, update me on vitals. BP 88/60, holding steady. Heart rate 118. O2 sat now at 91 and rising. Mara made the incision and inserted the chest tube with movements so smooth they looked choreographed. Blood and air rushed into the collection chamber. That's too much blood, Patel observed, his voice worried. Hemothorax, Mara confirmed. The bullet hit something vascular. We need to get him to, or now. The portable x-ray arrived. Mara studied the image, her jaw tightening. The bullet was lodged near the subclavian artery. One wrong move and Morrison would bleed out in seconds. This is a surgical case, Patel said. We should wait for The vascular surgeon is 20 minutes out. Mara's voice was flat. He doesn't have 20 minutes. Look at his pressure, it's dropping. Again. She was right. Morrison's BP was sliding. 82/55, then 78/50. Admiral Hardwick appeared at the trauma bay window. Reaper, what's the situation? Bullets kissing the subclavian artery. If it shifts, he exsanguinates. If I don't stabilize the vessel now, same outcome. Mara looked at the Admiral through the glass. I need to crack his chest. Here. Now. You're not a surgeon. A Secret Service agent protested. No. But I've performed field thoracotomies in conditions you can't imagine. Mara's eyes were hard as stone. I held Senator Pacheco's aorta closed with my fingers for 40 minutes while we waited for medevac. I've done vascular repairs with dental floss and hemostats. This is what I do. Did, Patel corrected weakly. What you did. Mara turned to face him fully for the first time. Doctor, you've worked with me for 8 months and never noticed I can place in 4 blind in 30 seconds. That I can read an EKG faster than the machine can print it, or that I've never missed a single clinical sign. You didn't notice because you didn't look. She grabbed the thoracotomy kit. Well, look now. Stevens, Hardwick's voice carried warning. Sir, with respect, the vice president is dying. I can save him, but only if I do this now. She met his eyes. Give me the authorization. The silence stretched for 3 heartbeats. Do it, Hardwick said. Mara's hands moved like lightning. Patel and the team could only watch as she performed a procedure most surgeons wouldn't attempt outside an operating room. Her fingers found the damaged artery, applied pressure exactly where needed. Vascular clamps, she ordered, her voice steady as a metronome. The nurse handed them over. Mara isolated the injured vessel, controlling the bleeding with movements so precise they looked like art. Morrison's blood pressure stabilized. My God, Patel whispered. The doors swung open 3 hours later. Mara emerged, still in surgical scrubs, blood spattered across her forearms. Admiral Hardwick and a cluster of Secret Service agents straightened immediately. He's stable, Mara said before anyone could ask. Vascular surgeon repaired the subclavian artery. Bullets out. No spinal involvement, he got lucky. Barring complications, he'll make a full recovery. The collective exhale was audible. Commander Stevens. A new voice cut through the relief. A woman in a dark suit stepped forward, phone in hand. The president would like to speak with you. Mara blinked. I know. Now. She took the phone. This is Mara Stevens. Commander. The president's voice was warm, but carried the weight of the office. I'm told you just saved my vice president's life using techniques most surgeons wouldn't attempt. I did what was necessary, sir. Admiral Hardwick tells me you've been working as an ICU nurse for 4 years. That you left the Navy after your last deployment. A pause. He also tells me you're the finest combat medic he's ever seen, and he's seen a lot. Mara leaned against the wall, suddenly exhausted. Sir, I appreciate the sentiment, but I'm exactly where I need to be. In an ICU where your skills are wasted? Where doctors don't even know your background? The president's tone sharpened. Commander, I've read your file. 42 missions, 37 lives saved in combat conditions, decorated for valor 3 times. Why are you hiding? The question hit like a physical blow. Mara closed her eyes. Because I got tired of seeing people die, sir. In the field, you can do everything right and still lose them. Here, in a hospital, with proper equipment and time, I can save more lives. You just saved a life that matters to 70 million Americans who voted for my administration. The president let that sink in. But you've been saving lives that matter just as much. The accountant in bed 3, the grandmother in bed 5. Admiral Hardwick, show me your hospital record. 0 patient deaths on your watch in 4 years. 0. Mara's throat tightened. I just do my job. No. You do everyone else's job better than they do their own. The president's voice softened. Commander, I'm not ordering you back to active duty. But I am asking you to consider something. What if you didn't have to choose? What if you could train others, combat medics, civilian trauma nurses, to be half as good as you? What if you could multiply your impact? Sir, I don't understand. I'm establishing a new program. Tactical medicine integration, putting combat medical expertise into civilian trauma systems. I want you to lead it. He paused. You'd have autonomy, resources, and the chance to teach others what you know. You'd still save lives, Mara. Just more of them. Mara's hand trembled slightly. I need to think about it. Take your time. But the offer stands. The president's tone warmed. And Commander? Thank you. David Morrison has 3 grandchildren who are going to grow up with their grandfather because of you. The call ended. Mara handed the phone back and found Admiral Hardwick watching her. You did good today, Reaper, he said quietly. I'm not Reaper anymore, sir. You've always been Reaper. You just learned to hide it better. He gestured toward the ICU, where Mara could see her co-workers clustered at the nurse's station, talking in urgent whispers. Question is, are you done hiding? Mara walked back to the ICU slowly. Rita met her at the door, eyes red. Stevens, Mara, I don't even know what to say. She shook her head. I worked next to you for 3 years and never knew. That was the point, Mara said gently. What? Dr. Patel approached, his earlier defensiveness replaced by something like awe. Why wouldn't you want people to know what you're capable of? Mara looked at her hands, steady now, though they'd held the dying vice president's artery just hours before. Because every time someone called me Commander or Reaper, it reminded me of the people I couldn't save, the missions that went wrong, the weight of, she stopped. I just wanted to be normal. You saved the vice president's life with your bare hands, Rita said. Mara, that's not normal. That's extraordinary. It's just what I was trained to do. No. Patel's voice was firm. I've been a doctor for 15 years. What you did in that trauma bay, the speed, the precision, the absolute certainty under pressure, that's not training. That's gift combined with experience most people don't survive long enough to acquire. Mara met his eyes. I was going to grab coffee. Want to join me? You can ask me whatever you want. His face registered surprise, then gratitude. I'd like that. 1 week later, Mara stood in the hospital conference room, facing the full trauma department. Admiral Hardwick sat in the back row, observing. Most of you know me as the quiet ICU nurse, Mara began, her voice stronger now, no longer carefully softened. Some of you learned last week that I used to be a naval special warfare combat medic. What you don't know is what I've decided. She clicked to the first slide. Images from combat zones, field hospitals, medics working under impossible conditions. I'm accepting a position with a new federal program training civilian trauma staff in tactical medicine. But I'm not leaving Riverside. This hospital will be the pilot site. She looked at Patel, at Rita, at the residents who'd watched her save the vice president. I'm going to teach you everything I know. Not because you'll deploy to war zones, but because every trauma bay is a war zone. Every code is a firefight. And the difference between saving a life and losing one is often just knowledge that someone forgot to pass down. Rita raised her hand. Will you teach us that thing you did? The emergency thoracotomy? That and more. Field tourniquets that work better than anything you're using now. Hemorrhage control techniques. How to make critical decisions in 30 seconds instead of 3 minutes. Mara smiled slightly. How to be invisible when you need to be, and unforgettable when it matters. After the meeting, Admiral Hardwick approached. You're staying here? I thought maybe you'd come back to active duty. This is my active duty now, sir. Mara gestured to the hospital around them. You were right. I was hiding. But I wasn't hiding from the military. I was hiding from myself, from the weight of thinking I had to choose between being a warrior and being a healer. And now I know I can be both. She extended her hand. Thank you for finding me, Admiral. For reminding me that saving lives isn't about hiding from who you are. It's about using everything you are. He shook her hand firmly. Make us proud, Reaper. I'll do my best, sir. 3 months later, Mara walked through the ICU at 0600, no longer invisible, but still wearing her faded gray scrubs. The difference was in how she carried herself, shoulders back, head high, the quiet competence now matched by quiet confidence. Morning, Commander. Rita called from the nurse's station. Morning. How's our post-op in bed for? Stable. You were right about the fluid management. Mara smiled. She'd spent the last 12 weeks teaching, training, transforming the trauma department. 2 lives saved last month using techniques she'd taught. 5 the month before. The numbers would grow. Dr. Patel appeared with coffee. Stevens. Sorry, Commander. Ready for rounds? Just Mara, she corrected. And yes, let's go save some lives. As she moved through the ICU, Mara caught her reflection in the window, no longer trying to disappear, no longer hiding from the warrior she'd been or the healer she'd become. She was both. She'd always been both. And now, finally, she was home.